Plus live Botox injections. If you ever wondered what it's like, we're going to show you on Good Morning Arkansas starting right now.
This is Channel 7 News. Good Morning Arkansas.
Today we've got Dr. Rhys Branman back as well from Cosmetic Surgery Center. We talked about implants last time. Today we're going to talk about something else that's very popular, Botox. A lot of people using it to look younger, to get rid of fine lines and wrinkles, but we're going to answer some questions. We're also going to see Diane, who you just saw there, get a Botox injection on the air.
Wow.
We'll see if she jumps or not. And we're going to ask Dr. Rhys some questions too about, can you still make facial expressions and all those things a lot of people ask about Botox.
Yeah, exactly what it does and how it works. And the results, I think, are pretty dramatic.
I think so too.
A lot of times. When we return on Good Morning Arkansas, we're going to head over across the studio talking about Botox. And Dr. Rhys Branman is here to tell us about that coming up.
Once a month, Dr. Rhys Branman is here from Cosmetic Surgery Center to help us understand a little bit more about some very common cosmetic procedures. And today we're going to talk about Botox, which I know a lot of people are doing, Dr. Rhys.
A lot of people are doing it. It's a really popular type of treatment and very easy to do, and people get great results from it.
Yeah, let's talk first of all what it is and what it does to your face.
Botox is botulinum toxin, and what it does is it prevents the nerves from making the muscles contract. If you ask, for example, Diane here, she's got these little muscles here. Go ahead and flex that for us. See how her brow and this area kind of contracts like that? Well, those are two little muscles that actually make those lines. And what Botox does is it prevents those muscles from working.
Because over time, that eventually creates a wrinkle.
It does, because that contraction of those muscles causes continual furrowing of those skin, and it's sort of like a continuous banging of that skin and makes a line.
So let's say Diane, who's actually had this before, you think it's a good thing?
I love it.
You love it?
It makes you look younger. You don't have a frown line so that people misunderstand maybe your expression. It doesn't make you not have an expression.
And that's a common question you get. Can I still have all my expressions?
Well, there's that common myth that you lose all your expression, and that's not true. What we do is we do just enough to make the muscles not work, but give you that natural look and natural expression that you have.
Can still look surprised.
Yes,
all
definitely.
Of that, exactly. So Diane comes in, and how do you start with her? Just
well,
to
what we
figure
do
out
is
what she wants.
we say, Diane, what would you like, or what's bothering you? And then she says, well, these lines here, or maybe some lines around the eyes are bothering her, and then we decide whether Botox is an appropriate type of treatment for her. Okay. And so what we'll do is we'll put a little numbing cream on there, which she has right now, and then what we'll do is we'll inject in these areas where the muscles are contracting.
Okay. Are you ready?
Are you ready?
She's already had her numbing cream, so we're going to do this.
Well, let me put on some gloves here, and we'll go ahead and do this.
And show you exactly how it works in the office, because this is basically it.
The Botox comes in a little vial like that, and then we put it into a very tiny, tiny syringe, and the needle is just about the size of a hair.
Okay.
And so I ask her to contract her brow just like that, and then you can relax. And then what we do is we just go ahead and in those areas where that little muscle is, we just inject the Botox. And it's very quick. You notice that with that numbing cream, she's really not having
not even flinching.
She doesn't even feel that, because that numbing cream really just absorbs right in there and allows that to take effect. And you know something?
Let you concentrate.
Within about 1 second, I'll just have you hold that just like that, sweetie.
Okay. Hold it yourself.
We're done. That's it.
That's it.
That's as long as it takes. And
how quickly will she see results then?
She will see results. Probably she'll see some subtle changes, some subtle softening of the muscles within the first 24 to 48 hours. And then after that, within about a week, she'll see a full effect where actually the muscles aren't contracting at all. Okay. Not only that, for her, what she'll get from this treatment is a little bit of a brow lift.
Oh, yeah?
And the brow's going to come up just a little bit. And that's what's really nice about treating this area right here, is that the brows will actually lift and get a little brow lift out of it. So
it's sort of an added benefit.
It is an added benefit.
Yeah. What are the most common areas? We did these lines, but I know the crow's feet are also...
The crow's feet are great. We can do the crow's feet right here. We can do the forehead lines that come across like that. And also, if someone has some neck bands down here, we can do those. It's a really exciting product. One thing that's really neat is that on some people who make those little pursing of the lips, we can do just a little tiny bit, and prevent them from making these little vertical lines.
I've also heard about underarms, especially
Yes.
for sweating.
Right. So there are some people that have just excessive sweating, and the Botox can be injected into the underarm area and prevent sweating for up to 8 months. It's very nice treatment. We also do it for the hands, too.
Yeah. Typically, how long do the results last?
For the face, typically lasts about 4 months. For the underarms and hands, about 8 months.
Yeah. And you could do this, go back to the office, you know. She's just holding to be sure there's no bleeding, bruising.
She's going back to the office in about 5 minutes.
Yeah. Are there some side effects sometimes to some?
Sometimes you can, if it's not given correctly, you can get a little drooping of the eyebrow. And that's really, you can get some bruising from any kind of injection that we do.
Right, but you do these yourself. No one else. You do these yourself, not
I
a
do
nurse.
all my own injections. I think that's important whenever you're administering any kind of a medication that the physician does that.
Okay. Anything else you think we should know about it?
I think, I think it's a wonderful product, and we're doing a lot of it at the
What do you
Cosmetic
think?
Surgery Center.
I can't wait.
Yeah, yeah, and it didn't hurt. I mean, you didn't even flinch.
It doesn't hurt.
Yeah.
The needle is so small, you literally don't feel it with the numbing cream.
There you go. So sounds pretty easy. Let's put up the information, of course, about the Cosmetic Surgery Center right there, Dr. Rhys Branman, or Dr. B, and it's over there on Executive Center Drive, Suite 100 in Little Rock, and there's the phone number if you'd like to call with more questions. I'm sure your staff would answer them. Just come in and talk about it, or if you think you're ready, come on in and make an appointment. Thanks so much.
Thank you.
We appreciate it, Dr.
Good
B.
seeing
Thank you, Diane.
Thank you.
You look great, and we appreciate you being here to tell us about it. All right.
Appreciate it.
This is Channel 7 News. Good morning, Arkansas.
We're going to take a break. When we come back, we're going to talk with Dr. Rhys Branman today about Abdominoplasty. You probably heard it better known as tummy tuck, and we'll talk about if it's for you. Up next. Welcome back, everybody. Time for our monthly visit with Dr. Rhys Branman. Good to see you.
Good to see you.
Yeah, you know, everybody's going to the pool now, and they may be seeing some parts they don't like.
Sometimes they do see that. That's right.
And I think the tummy is one part, especially women.
I think
and
it is.
Men too, I guess, you know, that as we age.
It's a big area that can be bigger, and we like to make it a little smaller sometimes.
Yeah.
And bathing suit season sort of accentuates that, and I think an abdominoplasty or a tummy tuck is one of the ways that we can make the tummy a little bit smaller.
Okay, we're going to talk all about it in case you've ever thought about it. But first, let's take a look at some pictures and the results of what you've had with some of your clients. And here's a look at one.
And this is, this is a smaller change. We see this sort of bulging of the abdominal muscles, and what we did is we tightened those muscles and gave her a nice flat tummy. You can also see that the incision line is way below, sort of near that bikini line, so it's going to be very well hidden in a nice bikini.
Okay, so you said a smaller change. So this is someone who's just...
Who's had children, just had a little bit of wrinkling, had some loose skin, and they wanted that tightened up.
Okay, and this one?
We've got a little more fullness here, a little bit of heaviness in the tummy. What we did is we brought everything down, got rid of some, did a little bit of liposuction with that.
Okay.
And again, you can see that bikini line, and you're not gonna be able to see it.
Right,
It's beautiful. And we gave her a little cuter belly button.
That's right, it is a little cuter. It's a little rounder.
That's right, it's a little rounder, a little cuter.
All right, and let's take a look at another one.
Now this is a lady who's had even more. You can see all this looseness right here in the tummy. And so what we did is we freed everything up, tightened her muscles all the way from her rib cage down to just above that pubic area, gave her a new cuter belly button. You can see that again, and put that incision very low so that she can also wear a nice bikini.
Does the belly button, does its placement change any?
The placement stays the same.
Okay.
The belly button stays right where it is. It's just all the skin around it moves down. Everything from this point in the belly button all the way down is gone.
Okay.
And we moved everything from up here down to there.
Very interesting.
Yeah, it's very exciting.
We could continue looking at the pictures, but we want to talk about a few of the points you wanted to make. First of all, who is a good candidate for this?
Well, the best candidates really are women who have lost weight, or men, lost a lot of weight, and they have a lot of loose, sagging skin. You really can't exercise away loose skin.
Okay.
Another group is women who have had children, sort of that mommy makeover that you've probably heard about, where the abdominal muscles have spread apart, and we need to tighten them back together and then get rid of the loose skin. Those are probably the two groups that we see the most of.
Okay, and how much are those muscles tightened?
They're tightened pretty good.
Yeah.
They're tightened from the rib cage right about here all the way down to the pubic area, so this entire length of the tummy. And so you've probably done sit-ups. I have too. Hard to get those tummy muscles tight. we can do it for you.
You can do it.
That's
All
right.
All right. And let's talk a little bit about the recovery. Does it require an overnight stay?
Not an overnight stay particular. Usually people go home the same day unless they're having other procedures with it. And the recovery takes about a week. They have a little pain pump in, some drains, and they come out within about a week. And then they're back to their basic daily activities.
Do you have to wear anything special during
Sometimes
that recovery time?
We put them in a little abdominal binder, a little cincher that kind of keeps them tight, keeps everything down, and makes it heal up real quickly.
So it's probably about a week out of work or whatever you do normally.
You're going to be a week out of work.
Okay.
But it's really well worth it.
Yeah, absolutely.
Really
and then what about the scars? Because we saw that they're still wearing their bathing suits.
That's the part I like the best, because
Okay.
we can hide all the scars within the bikini line and keep it really well hidden so that you can go and wear pretty much anything you want to wear today.
Yeah. Talk about one of the pictures. You said they had lipo along with it.
That's
so
right.
you can combine that.
We can. In certain cases, we can combine a little bit of liposuction, especially in this area right around the flank area, with the tightening of the tummy to get a very nice result.
Because some people, you said, usually it's someone who's lost weight, they have sagging skin. What if someone says, I can't lose that weight? It's there.
It's there.
I want to lose the weight and get the tuck.
We can help them lose it.
Exactly,
There you
yeah.
go.
Are you seeing this, of course, women in our pictures here, but what about men?
We're seeing it with men, but not quite as much. Men tend to have a lot of weight sort of in that tire that goes around the waist there, and in the love handles. And sometimes when they have lost a lot of weight, we will do a tummy tuck on them because they do have that extra skin that's down low, and they just can't get rid of that.
So again, if someone is curious about this, but they're just not sure if it's for them, what should they do as
They
far
need
as
to come on into the Cosmetic Surgery Center.
Yeah.
Consultation, we don't charge for that, and we'll give them an idea of whether they need liposuction, a tummy tuck, or maybe a combination of both.
Okay, very good. And let's put up the information, of course, about Dr. Rhys Branman. It is the Cosmetic Surgery Center on Executive Center Drive out in West Little Rock. And there's the phone number for more information. If you'd like to just give them a call and ask more questions, do that. They're happy to answer your questions at 227-0707. Thank you so much.
Thank you.
We
It's good
appreciate
seeing
it.
you
We'll see you
again.
again next month with
Okay.
some more information for us. Thank you, Dr. Rhys.
You're welcome.
This is Channel 7 News. Good morning, Arkansas.
And then we also have Dr. Rhys Branman back with us to talk about the latest, of course, in cosmetic surgery. And today, you know, we've heard of liposuction. A lot of people getting that to try to lose some of that extra fat or extra weight. He says there's a brand new kind. It's called Vaser Liposuction. And he describes it as a little kinder and gentler than the liposuction that we've heard about in the past. So he'll show us how it works coming up in just a little bit. Kind of ultraviolet light.
Did you say Vaser?
Yes. The Vaser.
Like, do you have to do the quotes when you say that? Vaser?
Vaser. Yeah.
Wow. That sounds kind of scary, but I'll bet Dr. Rhys makes it not so scary later on.
Sounds high tech.
All right, when we come back on Good Morning Arkansas, Dr. Rhys Branman is here, and he has his Vaser here. He'll explain it next.
Well, we're going to focus on some new technology this week on Good Morning Arkansas. Every day a segment kind of dedicated to new technological advances. And Dr. Rhys Branman is here from his office to tell us about the Vaser.
The Vaser, that's right.
Yeah. Before we get started on that, though, I saw your name in the program at Miss Arkansas.
Yes, you did.
Did you sponsor
We do. We
an
sponsor the
award?
Newcomers Award. We give 3 $500 awards, and I think it's just a wonderful cause to sponsor Miss Arkansas.
Very good, very nice, and we appreciate. She's a doll, isn't she?
She really is.
Very much so. I saw
She
you
really
get your
is.
picture made with her.
I know, couldn't resist.
All right, so a lot of people have liposuction.
A lot of people do, and
Yeah.
the newest technology now is the Vaser. You know, we used to do it the old way, which is, don't be scared.
Yeah.
Barry, don't be scared.
I've seen video of this before.
There it is.
Ugh.
Oh, I know. It's this monstrous thing, and we used to do it this way, but now with the Vaser technology, we use see the difference here?
Oh, yeah.
Look at the difference.
Much smaller.
Much smaller.
Not as scary.
What the Vaser does is this breaks up the fat and allows us to remove it very gently. Not only does this just targets the fat, that's why we call it also liposelection.
Okay.
And what this does is it melts the fat, and then when we take it out, it comes out very easily. There's less damage to blood vessels and to surrounding tissue, and so you get less swelling, you get less bruising,
Right.
and a quicker recovery. And we also get a smoother result.
Okay.
I think it's really a great technology. You know, we have a lot of pictures on our website, which is www.littlerockcosmeticsurgery.com. And, your clientele can go and viewers can go there and see all the pictures and results of these really great, this really great technology. This has been around for a number of years now, so it's very well tested. We use it in the majority of all our liposuction cases. And you can do it anywhere. Chin, waist flank, abdomen, anywhere there's fat.
What's the most popular area that people
I would say
want?
abdomen, waist flank, and back. This whole midsection area.
The
A lot of people want that.
It's hard to get
It's
to.
those areas, and people who just exercise and really, eat well and just have certain areas they just can't get rid of. That is really the best thing to lipo.
When they come, I mean, do you ask, have you been exercising? Have you been trying to lose the weight the normal way before?
We really want people to be at their ideal weight. And then we can go in and contour, and that's what this is. This is really a contouring technique, not a weight loss technique. And what we do is then contour those areas, and then they don't come back. So some people have these little bulge here, or a little bulge there, or a little one there, and we just get rid of it, and then they can go back to what they want. We can actually lose a couple of waist sizes in pants.
No kidding. Now, I have heard of people saying the weight came back, or it sort of migrated to other parts of the body. Is that true?
No, that's not true. Fat really doesn't migrate, but you do have residual fat, and so if someone gained a lot of weight, let's say they put on 20 or 30 pounds after liposuction, what can happen is you can get sort of a disproportionate, that area that used to be your spot that used to gain weight in,
You're right.
it would change to another area.
Okay, so that's what's happening.
That's what's happening.
If they're saying that. Okay.
That's right.
And does this all happen in your office, or does it require any kind of hospitalization?
The smaller procedures we do in our office, but the larger procedures, what we'll do is we'll do it in a hospital setting. Patient will be asleep, and then we can use this device to just do multiple areas.
Okay. And then what kind of recovery time are we looking at?
Usually about a week. They're back to doing everything they want to do, and then they see the results within about 3 to 6 months.
Any kind of special instructions when they leave the hospital?
Well, we keep them compressed. We like to
right.
put them in a little garment to help them stay compressed, and other than that, that's really about it.
Which is why you might want to do it not in the summertime, perhaps, would you suggest?
Maybe not. You might want to do it in the fall, or at least not when it's so over 100
If you're going to
degrees.
be outside a lot,
That's right.
perhaps. All right, and then how much weight or fat can someone expect to lose?
Well, we don't really look at weight. We look at sites.
Right.
Usually 2 or 3 pounds would be the most that someone would lose. That's the safe way of doing it. And it's really a contouring procedure where we're just contouring those areas, removing fat in specific areas so that you get an overall better shape to your body.
So it's not something to think about, I can't lose these 15 pounds, I'm going to go have lipo. It's contouring and making the body look better.
You're absolutely right.
Exactly. All right, well, let's put up the information, of course, about Dr. Rhys Branman. He mentioned the website there that has all the great pictures. And we'll link that to KATV.com to make it real easy for you to find. It is the Cosmetic Surgery Center over on Executive Center Drive, right off of Shackelford, right?
That's right, right across from the Heart Hospital.
Yeah, 227-0707 is the number. If you'd like to call with any more questions, he says it is kinder and more gentle.
It is kinder and gentler. It really is a better way to do liposuction now.
Okay, just the latest technology in cosmetic surgery. Dr. Rhys, thank you.
Thank you very much.
We'll see you in about a month, okay?
Okay, we'll see you then.
With more then.